Hi, I'm Dr. Joe DeMarco, chiropractor and owner of OcraMed Health. Today we're going to talk about the sternoclavicular joint. There's two of them. They're located right about in this general area, commonly referred to as the SC joints. Before we get into it today, I'd just like to make mention that if you've been checking out my videos, enjoying the content of my YouTube channel, please take a second if you haven't already and subscribe to my channel. Hit that little bell. You get notifications every time I upload a new video. And at the end of today's video, if you enjoy its content and you found that you learned a little something, I'd appreciate a thumbs up, okay? So let's get into the material today. So why are we talking about the SC joints today? It's kind of like this little tiny joint in the front of the body. What's the significance? Why are you even bothering with it? Well, the shoulder is a very complex joint of the body, and that's why it's one of the most frequently injured. We have all this awesome mobility of the shoulder joint. It's the most movable joint. We can do 360s with it. We can do all this awesome motion, but it also makes it very susceptible to injuries. And so I see a lot of shoulder injuries. And the shoulder joint, it isn't as simple as the knee joint. The knee to me is a very simple joint. We have a hinge joint here. Whereas the shoulder, we're dealing with the shoulder girdle, the shoulder complex, and the SC joint is part of this whole mechanism of the shoulder. And when the SC joint is not functioning properly, the shoulder joint isn't functioning properly. A lot of people have shoulder injuries, and a lot of times the SC joint is missed as a possible cause of some of their problems. Now, you can't just say when someone has shoulder pain, well, this is the cure for it. I mean, there's a lot of different reasons why shoulders, there's a lot of different reasons of why shoulders get injured, and there's a lot of different ways to go about fixing them. So I'm not saying this is the cure-all for everyone's shoulder problems, but I'm saying this could be possibly one of the problems you may have. If you have these ongoing shoulder injuries, you need to check the SC joint, okay? So what's the SC joint? It's basically where the proximal end of the collarbone, or what's known as the clavicle. So if you just put your fingers on your collarbone here, it's very easy to palpate, the bony structure, and just follow it to the very end. You'll eventually feel like the little nub here. So that proximal end of the clavicle forms a joint with the top of the sternum, or what's known as the manubrium. And you have one on this side and one on that side. And it's a saddle type synovial joint, and usually that means there's going to be motion in two planes. But the difference with the SC joint is there's a little articular disc in there that allows motion in a third plane. So the SC joint actually moves more like a ball and socket joint than your typical, saddle type synovial joint. I don't want to get too much into the anatomy, but I just want you to understand that there's a lot of motion that's supposed to take place at that SC joint that allows the clavicle to move. In other words, when you elevate the arm, or you depress the arm in this direction, there's a superior and inferior glide. Then there's an anterior and posterior and anterior motion going on when you're doing this. And what's this? This is, chest work, bench pressing. And then there's also because of that disc, there's also some backward rotation that takes place with the clavicle. So there's a lot of motion. And if it's not moving properly, what do you think happens? The clavicle can't move, and if the clavicle can't move, it translates all the stress into the shoulder. And what happens when you translate stress into an area, you're setting it up for an injury. Or you may have an injury and it doesn't get any better because you're not looking at the SC joint as one of the causes. And I see that a lot. People come in with these ongoing problems. They've had therapy. They've been doing these traditional, type of exercises and doing all this stuff, and it just keeps coming back. And a lot of times we'll just kind of just take a look at something a little outside the box, and we'll kind of follow the clavicle. We'll look at the SC joint. We do some tests, and they don't have any motion in that SC joint, and so there's this chronic stress getting translated from here into the shoulder. So that's what we're going to talk about today: how to free up this SC joint, get it moving, and prevent or cure some of these ongoing shoulder problems. So before you get into working on the SC joint to try to free it up, it's good to do a little self-evaluation. Now, I actually kind of start noticing when it's time to work on the SC joint a little bit, just in the gym a lot of times. If I'm doing a exercise where the arms are overhead, like I'm hanging to do chin-ups, or I'm grabbing the bar to do some pull downs, I'll just start noticing this, and this is where you really need that SC joint motion. You're holding on here, and that SC joint should be allowing for that clavicular motion here, and you just start, you feel it either pinching, grinding, cracking in there. It just doesn't feel right. Or you get on the bench, or you're doing dumbbell presses, and as you go back, you can just kind of feel it in there, and you're getting, I start getting a lot of grinding. It's one of those joints like the AC joint where, unfortunately, as we get older and there's some arthritic changes, it's one of those grindy type of joints. You move and you feel the popping and the cracking and the grinding. It's, welcome to, middle age. But it's one of those things that we can help. It doesn't have to be like that. I know a lot of older athletes that will tell me, oh, I don't bench press anymore. It hurts my shoulders, or they get pain at the SC joint or the AC joint, and they just stop doing it, and it's no need for that. You can fix a lot of these things, and so, I'm 57, I'm going to be 57 next week. I plan on benching forever. So, I just kind of stay ahead of it. I start feeling that SC joint tightening up, I work on it. I get it to loosen up, and that's what we're going to go over today, how to get this thing to loosen. So before you do, you may want to just take a little look at some different little quick analysis of it. For example, what I like to do is stand in front of a mirror and kind of run your fingers to the end of the clavicle on each end, and put your fingertips on top and look in the mirror. Is one side higher than the other? In other words, is one clavicle not dropping down properly? And if you find one side a little higher, put your fingertips there, bring your arms up, and see if that clavicle is dipping down like it should. Maybe you're not getting that motion this way, but you're getting it on that side. So it's an indication. The other thing, put your fingers on each end of the clavicle, bring the arm back. Do you feel that posterior glide? When you bring it back through here, you can actually feel the clavicle go back with it. There's like this glide there. So that's how, it's a good way to check it side to side. Sometimes it's both sides, but sometimes you can tell it's a very palpable difference. You bring this arm back, you feel a nice glide. You bring this arm back, you don't feel the glide, so it's an indication that we need to do some work. So we're going to go at this a couple different ways. One is sometimes we need to release the clavicle in general. The clavicle, there's a lot of tissue here. There's the clavicular portion of the pec major. There's the subclavius muscle. You can build up fascial adhesions and all of that. That can kind of glue down the clavicle down to, you can glue it down, that affects the shoulder motion. So number one, we're going to kind of get in there and try to dig that out. And the second technique we're going to do is get in there and try to force, or I shouldn't say force, but try to work some motion into the SC joint. Okay, so all different techniques of how we can kind of free up this clavicle just from, breaking up any fascial adhesions that have built up over the years. Common area for fascial adhesions, so we want to stay ahead of it, we want to work it. First off, just using your fingertips. I'll just take 2 fingers and I'll just go right underneath the clavicle as deep as I can, and I'll just kind of dig back and forth, and as I go, I work my way right across the towards this midline like that. So I'll start out about here, back and forth as deep as I can take it, going to the midline. 2 fingers you can use. You don't want to, you want to get a little more, advanced on this. Take a spiky ball. This is a Tai Chi ball from OcraMed Health that a lot of you people have out there. Get the spikes in there. Get this underneath the clavicle. Same thing. Just start digging those spikes nice and easy, but with its firm pressure as much as you can handle. Back and forth, up and down, and go work your way towards the midline with this. That's another great way of working breaking up the adhesions right underneath the collarbone. You can feel it. It's a very palpable area. You can get right underneath that collarbone and just work right across. If you have a fascia release tool, this is the FF5. I'm just showing you all different options that you have to work this. You can get in on this nice and easy with one of the edges of this tool. And I can kind of get in there and I'll glide this back and forth and I'll dig right underneath there. I'll go back and forth. I find a little knot, I'll spend a little extra time back and forth, up and down on a little adhesion that I might come across. About 30 seconds I'll just spend on that, a little adhesion. Same thing, you can do that with your fingers. And then lastly, everyone has a massage gun these days, right? It seems like you can get the massage gun out. Now, I would get the ball off. A lot of people use the ball. It's too big. Try to find an attachment that's smaller. This is the SRI 3.0. We have some smaller bullet-like attachments. And that's a great attachment to get in there, get it right underneath the clavicle, and just drag this right across the midline like that, as much pressure as you can handle. If you find a knot, once again, when you just put direct pressure on that knot, if you find a knot right underneath the clavicle, maybe it's the subclavius muscle that has a lot of adhesion, just hold it for about 30 to 60 seconds right there. And you can work it through with that. So there's a lot of different ways you can get at the underneath the clavicle here to free it up. So there's a bunch of options for you. Once you've kind of gone underneath there, let's work around the SC joint. Once again, say if I'm using my fingers, I've come to the end of the clavicle, I'll just go right around the SC joint, right around this area. So I'm at the top of my sternum, and I'm just digging right around that joint. And I'm going to spend about 60 seconds with my fingers, or I can get back in with the ball. It's a bony area because we got the manubrium here, the top of the sternum, and we got the end of the clavicle. But there's soft tissue in there that you can kind of dig away at. Just use firm pressure to what you can handle and spend some time just digging around that area also. So go to your tolerance. If you're new at it, go a little easier. Make sure you're warmed up before you do it. But the first thing we need to do is kind of dig out any adhesions, try to break up any restrictive tissue in there. Next, we're going to get into what we can do to help actually increase the motion of the SC joint. So we're going to get some movement in. Now, as I mentioned, if you notice a difference on one side, work the side that's not moving more. I like to work both sides. Even if my right side might be giving me some trouble, I'm going to do everything on both sides, but I'll spend a little more time on the SC joint that doesn't feel like it's moving as well. So when you kind of went through some of those tests and you felt that maybe your right SC joint wasn't moving as well as your left, spend a little more time on this side. So a lot of the stuff, I'm doing it sitting up. It's sometimes best to do this. I would do this, everything I'm going to show you, but do it sometimes lying on your back. Lie on your back. It can kind of relax things a little bit more, but just for video purposes, it's easier for me to demonstrate, sitting like this. But I would actually do a lot of this sometimes just lying on my back on the ground. It relaxes you a little bit more, and you can kind of get a better release on the joint. But what I'm going to do is I'm going to come to the end of my clavicle to the midline. Say I'm working my right SC joint, and I'm going to take my fingers and I'll rest it on the top of that clavicle there. Okay, so I'm coming to the end of the bone. I'm listing it. You can either drop these two fingers, or sometimes I'll just drop my thumb down on the end of the clavicle right here. So I'm on the proximal end of the clavicle here. Okay, and then what I'll do is I'll come up with my arm. Now, as the arm is going up, there should be like an inferior drop in the clavicle through the SC joint, with the motion of the SC joint. So I'll kind of go with it. So as I'm lifting up, I'm going to press down with my thumb on the end of the clavicle. Then I'll come back. I'll put my thumb there, and as I go up, I'll just kind of add to that motion. So in other words, if I'm coming up and I'm not getting that drop in that clavicle like I should, like I said, you can use your two fingers. I'll just kind of guide it. I'll guide with it. I'll just kind of guide the clavicle downwards. And I'll do this about 10 times. I'm just putting firm pressure. I'm not forcing it, but I'm kind of putting like that weight down on it. I'm kind of dragging my arm. I'm pulling down on it. And as I lift up, I feel it drop down. I've done it sometimes where actually it's been so locked up that as I do it, I'll actually feel a little clunk, and it actually it almost like completely releases the joint. Sometimes it'll be so locked up in there, I'll give it one of these and you hear click, like a little clunk in there, and it drops right back into position. It feels awesome. Other times you just might feel a little grinding, you might feel a little resistance, but give it about 10 repetitions where you do this. You just keep pulling down. Then I'll get underneath it. So I'll get to the end with those two fingers again underneath, and I'll kind of do like this shrug, and then I'll depress the shoulder down. At that point, the clavicle should be going up. It may not be, so I'm gonna kind of guide it up. I got the fingers under there, I'll kind of come up. As I drop down, I'm pressing in this direction. Once again, I'm not forcing it, but I'm just trying to go with the way the clavicle should be moving. It should be kind of going up at this point as the shoulder depresses. The clavicle at the SC joint should be gliding up. Once again, I'll do 10 repetitions where I just keep gliding that motion down. Once again, sometimes you feel a little clunk in there, releases the joint, feels awesome. And then finally, I'm going to kind of do this motion, where I'm bringing the clavicle posterior. The proximal end of the clavicle should also go posterior. It's kind of unique, the SC joint. I don't want to get into it, but there's actually the end of the proximal end of the clavicle and the part of the manubrium that form the joint. There's actually both convex and concave surfaces. I don't want to get into all of that, but suffice to say that actually, although this way drops the clavicle down, when you go back in a posterior direction, the SC joint, the proximal end of the clavicle, also goes posterior. So once again, either with my thumb or my fingers, I'll start from here like in a protracted position, and I'll retract the scapula back. I'll pull back, and as I do, I'll keep pushing, and I'll try to really push that clavicle back with it. Again, come out, push back. Sometimes in this position, I even like to use something a little bit like I'll put the ball right on it, and I'll put my palm on the ball, and I'll kind of push it in that direction like that. Sometimes I'll try to get in with my thumb. Sometimes I'll just get in here with my hand, but I try to do something where I can kind of come back and at the same time push and get that motion of the proximal end of the clavicle, to get that motion of the SC joint going. So those are the main motions I work after I do the fascial release work. We work on bringing it, working it, pulling it down, pulling it up, and then going posterior with it. All right, so I hope you find those techniques helpful. You know, what I do if I'm just having that little periodic tightness in there, I may just do those techniques every other day for like a week or so, and it seems to release my SC joint. And I may not bother me again for a few weeks or a couple months. But if you're having like you're dealing with like kind of chronic trouble and you're noticing that the SC joint is really locked up in there, I would work those techniques like every other day. You may need to be doing it for 4, 6, 8 weeks of constant, consistent work on that to really free up that SC joint. It may be really cemented or glued down in there and it's not working that well, and you may need to get it. But do those techniques, get back to me, leave a comment in the comment section below. I'd love to know how you guys make out. If you're someone that had to give up a particular exercise and you do those techniques and you can get back to bench pressing again, let me know. I'd love to hear about it. So, hey, listen, if you've been enjoying these videos, please subscribe to my channel, OcraMed Health on YouTube. If you found this information helpful, I appreciate a thumbs up. If you're interested in the products that we demonstrated, we have the Tai Chi ball from OcraMed Health, our faster release tool, our SRI massage gun, all available on my website, www.ocramedhealth.com. If you'd like to support the channel, visit me on Patreon. Appreciate any support to keep the channel going. Questions about exercises or injuries, just leave a comment in the comment section below. I do the best I can to get back to everybody. And don't forget, OcraMed Health is here to keep you fit forever.